Well, for the record, I'm Richard Hooper. I first became involved in the organization at Home Health Care before it actually began. Prior to that time, I had been the county director for Head Start, and prior to that, I was a school principal. I thought my career was going to be long-term in education. It turned out I had opportunities to do something else. Quite by accident, being involved in the creation of Androscoggin Home Health Services. Well, the conditions that Maine seniors were living under back in 1965 were in many respects the same conditions that were being experienced across the country. The idea of home health care as we understand it today was virtually non-existent in 1965. So the thing that amazes me now is how prescient, how forward-thinking the people who wrote the Medicare Act, or the law, were smart enough to look ahead and say, you know, there's something missing in this so-called, and I say so-called, healthcare system. In the state of Maine, with the exception again of Portland and maybe Bangor, there were no organizations providing home health services. So the act was passed July 1, 1965. Lyndon Johnson signed off on it, and it was to be effective July 1, 66, 1 year later. So early in 1966, I was contacted by a woman who was the wife of the Dean of Faculty at Bates, Dorothy Healy. So she began making phone calls and she contacted me. I forget if she did it in person or by phone, didn't matter. Would I be willing to serve on a small committee to develop a organization to provide home health services? Well, quite honestly speaking, I wasn't really sure what the heck she was talking about, but I liked her so much, I said, you know what, Dot? I'll give you a hand if I can help. So I did. And there was a very small group of us in Lewiston, Auburn primarily, who formed this pre-organizational group that planned toward the development of what became Androscoggin Home Health. In the earliest days, we had long discussions about what we were going to call this thing. We had various names for it. Tri-County, there's a lot of tri-counties in America. Androscoggin Valley, we finally settled on Androscoggin. The river comes out of Oxford County, it touches Franklin, and it comes down through Oxford, through Androscoggin. So we call it Androscoggin Home Health. And on June 23rd, we met with a lawyer and we formed the organization. We were official, and we were recognized by the state of Maine right after that, on July 1. So we plotted our way toward operations, which we began in January 1967 with a single nurse and no director. So we had volunteer leadership of the organization for the first 9 months of our actual operation in 1967. It was a hard sell for a lot of people because the doctors who were an integral part of this thing, who were required to refer patients in order for anyone to receive the service, we had to educate them. We had to educate the public into what not only home health was, but what Medicare was all about. And it just all was brand new. Think of it. millions of American people on July 1, 1966, boom, eligible for hospital care coverage, doctor coverage, home health coverage. Most of the folks in America couldn't get it at that point because we were all trying to put together organizations in order to provide it. So through one tremendous effort, really, we were able to be operational in January. We hired a nurse who had some experience working in the community. Her name was Lucille Guyerson. She gave us an excellent start. We had 2 consultants, expert consultants, nursing consultants from the state who were pledged to help us integrate into the community and to know what to do. We had a very supportive Deputy Commissioner of Human Services by the name of Bill Carney, who was just a wonderful, wonderful help, not only to us, but around the state. Really, we had a collaborative relationship with what today is called the Department of Human Services. So that's some of the background of when we started off.